Hi, good morning. I'm Dr. Sadhvia and I'm from Promed Hospital, and I'll be talking to you today about basics involved in managing poisoning and road traffic accidents by you guys and then later by us. Alright, so we'll start with poisoning. A poison doesn't necessarily have to be ingested, even though it's the most common mode of poisoning. It can be inhaled, poisoning can happen through touch, and of course, your snake bites that are really common here too. Right, so let's just start with a few basic things that need to be done. What is not poisonous for us can be poisonous for children. So common articles like cosmetics and deodorants and shampoos and conditioners, even small batteries and buttons can be really hazardous to children. So try keeping them out of the way. Alright, for example, a battery in the foot pipe of a child can cause severe burns in the esophagus and becomes an emergency. So that care needs to be taken to keep them out of the reach of the children, right? And when do you suspect poisoning, or what do you do when you think a person has been poisoned or has ingested something or has tried causing self-harm? Look around for clues because poisoning imitates or mimics a lot of diseases like seizures, like stroke, like alcohol intoxication can also look a lot like poisoning. So when a person is vomiting, when a person has low sensorium or is drowsy rather, or when you find blister packs nearby, like empty blister packs, or any stains, suspicious stains nearby, then you do strongly suspect poisoning, right? And bring them immediately to the hospital, call for an ambulance, and in the meantime, what can be done is clear the airway of any remaining substances that are there in the mouth, okay? Remove it, all right? And if they're vomiting, tilt their head to the sides so that they don't choke on their own vomit, all right? If it's a poison which is coming through their clothing, like on touch, you remove the clothing and make sure they're getting irrigated, which means you take them to the shower and give them about 15-20 minutes under continuous irrigation. That is in case if the poison is coming through touch. Okay. Now, in case the poison is inhaled, you take them out of that particular room that they're in and give them some fresh air while waiting for the ambulance. All of these measures are done while you're waiting for an ambulance, while you're waiting to take the patient to the hospital. Because the best thing that you can do is take the patient to the hospital. Another thing that we would appreciate a lot is if you find empty bottles or empty blister packs, bring it with you so we know what has been taken. If they've taken like organophosphate, which is fertilizer or pesticide poisoning, bring it with you so we know the composition of the poison. It makes it so much more easier for us to treat a case of poisoning if we know what it is. Okay. The next thing that we most commonly see is probably a snake bite. Rather than what to do, I think what needs to be stressed about is what not to do. All right. The old method of cutting and sucking the poison, that does not work. Okay. If you cut, you cause injury to the local tissues, and when you suck, you do not suck the venom out. So it does not work. So please do not do that. And applying tourniquets and big compression bandages above the area, that does not help anymore too. All right, so just bring the patient immediately to the hospital. That would be your number one do. And your second thing would be, do not move the limb in which the patient has been bitten too much. Kind of delays the spread and circulation of the venom. That's all it is. All right. And if the local area can be cleaned with just water and soap, that would be sufficient. If there's any fang left back, remove it. And that's it. All right. Just bring the patient as soon as possible to the hospital. For all kinds of poisons, the first thing that we do is ask you what time it was taken at and what the poison was. So if these two things can be addressed or told to us in a proper manner, that itself would be sufficient. If you can identify the snake, well, good. But if you can't, please don't go chasing after the snake and trying to bring us the snake, thereby taking a risk of your own life or limb. Okay. Once you come to the hospital, once we determine what kind of poison has been taken, if there's a specific antidote for that poison, we generally tend to administer it immediately. Like for snakes, we have anti-snake venom available, which is extremely life-saving. If we don't have any specific antidote, then we treat the patient symptomatically. But of course, the first step would be to ABCs, which is airway, breathing, and circulation. We try to make sure that all three are, maintained well or working at least adequately enough. Right? Then the specific antidote. If there's no antidote, then we give them a symptomatic treatment. Okay, so this would be the way we approach poisoning. So the two things that you need to be able to tell us is what poison it was and what time was it taken at. Okay, that's as far as poisoning goes, and that's just the general thing that you guys can do for poisoning. The next thing that we come across to very commonly in our lives, I think every day all of us see an accident or are involved in an accident, directly or indirectly, right? So the first thing I tell you is please stop and help. There is no reason why we shouldn't stop and help any time of the day for whoever it is. What goes around comes around. Someday we might need that help, so stop, help. Right? Now, the second thing is if you're involved in an accident, check yourself first. Check to see if you have injuries first before rushing to help somebody else. Right? Self-help is the best help. All right. So once you start checking yourself and you feel you're okay, no injuries that need attention immediately, or very minor injuries, then step out, look at the other person. Now, when we generally go to a big accident site, we try to triage the patients. Like we see who requires immediate help and who requires lesser, or can be taken a look at later. Okay, so you can also do a minimum amount of that. If a person is crying for help and there's a person next to him who's kind of quiet, not really crying, but doesn't look too good, look at that patient first. Okay, or look at that person first. He might not be able to cry for help, but might be severely injured. So you need to put more attention on that patient. All right. So once you take a look at the patient, if you think, obviously all of this happens after you've called the ambulance, all right, or the ambulance is on the way, okay? Now the do's of it is if it's an open wound, okay, you can apply a compression with a clean cloth or whatever cloth is available, but not too dirty, and apply pressure with the palm of your hand, preferably than the fingers of your hand, and that will stem the blood flow, okay? If it's if the person is lying at an awkward angle or any road traffic accident where the person is lying down with altered sensorium, please always suspect a spinal injury. Okay, please do not move a patient when you think there's a suspected spinal injury, because the way we transfer is we transfer it as a unit. Like the entire body needs to be transferred as a unit. All right. So the body, the head, the neck, everything is transferred at the same time to prevent any movement of the neck, which further damages the patient. Okay, so you'll be doing more harm than good if you try to move the patient just however you want to move the patient. All right. So always suspect spinal injuries. Never assume that there is no spinal injuries. Another thing we see often, but we tend to discourage is don't feed or don't give the person a drink. Like give them a glass of water. If any degree of altered sensorium is there, if they're not able to sit up, they're a little drowsy, if they're, vomiting now and then, don't ever give them a drink of water. Either they choke on it or be a little later, they tend to have, a bit of aspiration. So the whatever they ate comes back and goes to cause aspiration, okay, which is very dangerous and needn't happen. You do not have to give them a drink or give them something to eat that urgently, all right? In case of bleeding, sometimes they go into shocks. They might start feeling cold, so keep them warm, okay? Your t-shirt, your, dupatta, shawl, anything, just to, keep them a little bit comfortable, all right? In the ambulance, if it's a limb that's bleeding, you can always lift the injured limb up to prevent, further bleeding, compression, and bring them to the hospital. All right. In the hospital, we approach it as: is it a fracture or is it not a fracture? Or of course, the primary step would be A, B, C in any case. Okay. So once we, secure the airway and make sure the BP is okay, he's breathing fine, then we start looking at other injuries. Okay. So we look for fractures, we look for soft tissue injuries, and we look for any, inner bleeding, so a quick ultrasound to check if there's any injury inside, x-rays of the affected part to check for fractures, and then the multidisciplinary approach, all the experts come in and start to manage, all right? So however quick you bring the patient into the hospital is however much you increase the chances of the patient having a normal, regular life without any loss of limb or life. Okay, so that would be, if I can give you a message to take home today, is to help, and please bring the patient as soon as possible to the hospital. But if there are a few things that you can do it intelligently. Don't ever do something that's going to cause harm to the patient. Okay, don't go on popular beliefs and what they show in the movies. Always, at least read up. If you're not listening to me at this point of time, you can always Google it. Okay, they have a few basic things that you can do. So please do what is required from or what you can be doing at your side, and then hopefully we can take care of the rest. I had a good time doing this. I hope I see you guys again soon.